Okay, so this is a little video about cannulation. So we're going to go through a little bit of technique and a little bit of the equipment that you need to bring with you when you go to do a cannula. First of all, I've laid out all the cannulas, so most of the cannulas that we have access to here in the hospital, starting down here at the smallest. So we have 24 gauge, which is the yellow, and 22 gauge, which is the blue. These are mostly used in pediatrics, or the blue occasionally in someone who has extremely difficult access. The reason we try and avoid using these is that they're quite short and they're quite likely to fall out of most patients with regular veins, anyone that is moving about. What you should be aiming to do as an intern is work with the 22 gauge cannulas, or excuse me, the 20 gauge cannulas, which are the pinks, and the 18 gauge cannulas, which are the greens. There's two different types here. So there's this cannula on the left hand side has no wings on it, and this one on the right hand side has wings on it. If you can find these ones with the wings, then do use them, because it can help secure them in place by having those wings on the outside that you can take down. Again, the reason we try and use these cannulas is that they are slightly longer than your very, very small ones, so they're more likely to stay in. And of course, the wider and bigger a cannula you put in, the faster you could get fluid into it. And that leads me to our cannulas that we use for resuscitation. So here we have the grey 16 gauge cannula and the orange 14 gauge cannula, which are very wide and very long. These are used for giving high volumes of fluids over a short period of time because of the increase in radius in these cannulas. So what you'll be looking for is your 20 gauge and your 18 gauge. If you see a lovely big juicy vein, then use the 18 gauge because it is less likely to fall out. Additionally, you'll need a nice clean fresh tourniquet, something to clean the skin with here, a sani cloth, a bung to place on afterwards, a dressing to place on, and we also bring a little swab or some sort of tissue and tape just in case you're not successful in getting your vein. I've also included a syringe here for two reasons. First of all, a flush, so any sort of flush, either pre-filled or a syringe with some saline, or if you have to take bloods, you can take them from the cannula once you've placed them in, if you can get decent backflow from the vein. So keep a syringe handy if you additionally need to take bloods from the patient. You can take any regular bloods you need, up to and including a venous blood gas, a VBG, which most of the time is sufficient for someone who needs blood gas analysis. Okay, so that's our equipment, and here I have a willing victim. So Ola is going to have his arm just search for a vein, and Eva Corcoran here is one of our anaesthetic doctors who's going to show you just how we search for a vein. So first of all, put the tourniquet on nice and high up on the arm. So you're looking to get it nice and tight. Make sure it's not too loose. Warn the patient this might be too tight. If it gets too sore, then just tell me and you can release it. So you can see Eva is allowing Ola's arm to hang down here. So gravity is helping fill up the veins. This can be important in someone who is a little bit hypovolemic. So you can look down at the hand first, and you can see that she's looking, she's tapping, and she is, if you can see where she's holding Ula's hand, and she's putting her thumb across his knuckle to help stretch out the skin a little bit. So this stops the veins moving. In a young, healthy person, this is not so much of an issue. They tend to have more taut skin, but in an older person with more frail or friable skin, then the veins can move around quite a bit. In that case, when you try to put the needle through the skin, you'll end up just causing either a puncture in the vein or completely pushing the vein out of the way and being unsuccessful. So pull that skin gently taut over the knuckles, and that'll help your success. You can also see how it fattens up the veins. Right, so you can see Ula has lovely veins there in his hand, so you would go straight for those. But additionally, let's have a look here on the forearm. Don't forget about the forearm, particularly in quite thin people or quite muscular, young, healthy people. You can see lots of nice straight veins in the forearm if you spend time feeling around, feeling for those nice juicy tubes. So they feel like tubes of fluid. So you can see, you might be able to see that vein there, but Eva can feel a nice big vein there that you could fit a large bore cannula in. So overall, we're spending lots of time. When you come up to the anticubital fossa, turn the patient's hand up towards the ceiling to expose the entire anticubital fossa, and search from the medial aspect all the way to the lateral aspect. Again, looking for nice little juicy tubes that you can feel a lovely bounce out of. So there tends to be at least 3 large veins up around this part of the body, where Eva is searching there laterally. one a little deeper in the anticubital fossa and then more medially. So that tends to be where most veins are, but it of course varies from person to person. So Eva has now chosen where she's going to put the cannula. And what we do then is we get everything we need open first. So you don't want to be flailing around looking for your bung if the patient is bleeding all over the place, or your dressing to secure your cannula in place after spending all that time looking for the vein and getting access, hopefully. So everything ready. Make sure you have a nice clean tray. Now we have something to clean the skin. Sometimes cleaning the skin with the wet alcohol wipes can help reveal some veins, so just causing the skin to be wet and a little bit of a shine means you can see the veins a little bit more. If you have cleaned the skin, try not to do much poking about with your thumbs at the skin then, because your fingers may not necessarily be clean. I'd like to point out at this stage that Eva is wearing gloves. You should always wear gloves. People say, oh, I can't feel veins with gloves. If you start putting in cannulas with gloves, you will always be able to feel veins with gloves on. Okay, so start how you mean to carry on. Now, I'm going to show you the angle that Eva, so how she's going to hold Ulla's hands and the angle she's going to use. So if you see how she's holding the cannula there, so that's another advantage to these cannulas with wings on them. They have this little port on the top of them that we use for injecting other medications, but it allows us to hold the cannula in this angle. So that vein there, you can see, lovely big vein. She's holding it quite close to the skin, and it's quite a shallow angle. So you don't want to go too high up. Big 45-degree angles, you're going to go straight through the vein. This vein is barely underneath the skin. It's a millimeter or two at most, so you're going really, really shallow in. What I'll also show you, if my camera will allow to zoom in, is that the needle is longer than the cannula itself. So that's the purpose of it, is that the needle comes out, punctures the skin and then the vein, and then you advance the cannula in. However, if you don't advance far enough and your cannula is outside the vein while your needle is inside, you'll get lovely flashback here into your port, but your cannula will be sitting outside the vein. So it's a few millimeters in, and then you can advance your cannula in and off your needle. And then once your cannula is in, we're not going to cannulate Ulla today, we're going to spare him that needle prick because he doesn't need it. Once your cannula is in, advance all the way, so your needle comes all the way back. It doesn't need to go far into the vein, but your cannula does. These ones have a nice little safety grip on them. Now, tourniquet off so that the patient doesn't bleed all over the floor afterwards, and now his veins are going to start to deflate a little bit. Now you can see how Eva's holding it in place and lifting it up a little bit higher so that the veins are a bit more deflated. So we're working against gravity here. She has put some pressure up here, just proximal to the cannula, so that she's compressing the vein and it's not going to bleed out on the ground. Okay. Once you have the bung on, you're okay to release the compression on the vein. Now, she's placing it on Ulla's thigh and telling him not to move, don't flail about till we secure this. So all the dressings are slightly different, but whatever you do, do whatever is required to keep it nice and steady. And one thing you do want to do is where the bung is, you want to put something across that so that nothing catches out where the bung is and pulls it back and off the patient. So what we usually do is we use this little date sticker that's on our cannulation dressings, and we put that across the top of the bung. You can use any sort of dressing or tape to do this, and it just stops it being dragged back in the wrong direction. So cannulas typically stay in for 3 days. There's no real evidence for anything causing major infections after 3 days, but we start reviewing them at 3 days or thereabouts. If you have a patient with a difficult cannula, then just review and document in the chart that you wanted to carry on for another day or so, but make sure you do actually look at it because they can get infected. So that's the arm. It's pretty much the same for the feet. You put the tourniquet on around the ankle and have a look for veins down there. They can be very useful in a patient who is quite delirious, demented or aggressive, because they often can't reach them. And that is our little cannulation video, and I'm sure you'll be very successful after all those helpful tips.